Turning back the pages of DJRMH history, 100 years had passed when the early Dapitanos stood as once the living witness of how the Philippine national hero, Dr. Jose Protasio Rizal, spent 4 years of his life exiled in Dapitan. Inspired by his life, by his passion of serving others, the people of the Dapitan's dream was realized on December 30, 1916. At Casa Comandancia, the Rizal Memorial Hospital carved its name in the history, a hospital with 1 resident physician, 1 nurse, 1 administrative officer, 2 nursing attendants, 1 cook, and 3 helpers. RMH continued its operation. More and more patients came for its services. As the years passed, Casa Comandancia could no longer accommodate the growing number of patients seeking for admission. The hospital needed a new building, a bigger space to cater all the patients. In March 1927, RMH was transferred to the upper floor of the Dapitan Municipal Hall, while the Casa Comandancia was demolished in 1928 to give way to a new building. However, the construction of the new building was not pursued because of the virtue of an Act 3453 approved on December 1, 1928, transferring the hospital in Ipolog, considering that it was the most progressive town of northern Zamboanga. A challenge that brought the people to protest. 5,000 men and women gathered to join the parade of protest, fighting to repel the resolution. On the other hand, Dr. Jose Rizal's sister Trinidad wrote a letter to the Governor General in behalf of the Dapitanos, while vivas and cries of "Long live Dapitan" echoed all over the place when the news came that the notice was in favor of the people of Dapitan. A monster parade was held, and about 3,000 people of every age carried torches as they marched through the streets. 1931 of January, the new hospital building was inaugurated. However, in 1943 to 1945, the Pacific War happened. The Japanese invasion destroyed most of the hospital's equipment, that forced the RMH to transfer its equipment to the different barrios of the municipality of Dapitan. 3 years of war, and finally in 1945, when the American forces were in full control, RMH returned to its own building in Dapitan. By then, the hospital received supplies and equipment from Philippine Civil Affairs Unit. For the second time during its Town Fiesta celebration in July 25, 1945, the hospital had its second inauguration. From then, rapid expansions were done. With the increasing number of patients seeking for admission, additional facilities were added. From its original 25, it was increased to a 50-bed capacity hospital in 1956. In 1958, RMH was approved as a hospital with 75-bed capacity, while an ongoing expansion of the main building was done and completed in 1959. By then, the nurses and doctors' quarters were raised to 2 stories in order to accommodate additional hospital personnel. December 30, 1966, RMH celebrated its 50th founding anniversary under the leadership of Dr. Guillermo C. Tuazon. One of the highlights of the celebration was the distribution of the souvenir program, with a brief history of RMH and the directory of the different chiefs of hospital from its existence up to its Golden Jubilee celebration, which was written by Florentino A. Cod. In November 1979, the hospital was able to purchase a 3-hectare lot under the administration of Dr. Crisostomo N.A. Alda. This lot was intended for the construction of a new hospital building. In 1985, the integration of health services under Executive Order No. 851 renamed RMH as Rizal Memorial District Hospital. Its field health services includes the neighboring municipalities of Rizal, Sibutan, and La Libertad. In 1987, Dr. Floresfina Mabagos assumed as new Chief of Hospital. During her leadership, RMDH celebrated its 75th year in 1991. In the same year, the hospital was transferred to its 3-hectare new site in Lawaan Daud, Dapitan City. A year after it was relocated, the hospital's senior resident physician, Dr. Grashati Amoy, then assumed as the officer in charge. June of 1993, Dr. Cecilio P. Siglos became the chief of RMDH. During his term, the hospital was devolved to the local government unit of Zamboanga del Norte. The LGU constructed the hospital's tennis court, water tanks, and renovations were done in the main building of the hospital, including the 4 private rooms. On July 30, 1996, under Republic Act A200, RMDH was renamed to Dr. Jose Rizal Memorial Hospital, converting it to a 200-bed capacity hospital under the technical supervision of Department of Health. However, on April 2000, Dr. Siglos and the 96 staff were rationalized and transferred back to the DOH status quo. On the same year, Dr. Siglos was detailed in Zamboanga. Thus, the regional director, Lourdes C. Labiano of Center for Health Development, Zamboanga Peninsula, assumed as the OIC of DJRMH. After Dr. Labiano's leadership, Dr. Romeo Ong was assigned as the new OIC. During his term, 8 plantilla positions from DOH pool were permanently deployed at the DJRMH, making a total of 104 staff personnel. After Dr. Ong, Dr. Oswaldo Chia became the hospital's OIC until October of 2003, replaced Dr. Ramon N. Neri, who was then appointed as the new chief of hospital. In 2006, the hospital received 10 million funding for personal services and 20 million for maintenance and other operating expenses. However, before the utilization of the said amount, Dr. Neri was detailed to Region 10 in Cagayan de Oro City. Thus, a new OIC assumed from Region 9, Zamboanga Peninsula, in the person of Dr. Maria Dina C. Viray Parinas. In 2008, the amount received for personal services was realized into additional 43 positions, making a total hospital plantilla of 147 positions. The 20 million budget then for MOOE was realigned for the construction of the hospital's ICU, laboratory, cadaver holding area, and the TB dots. These projects took 3 months for its completion. In 2009, Dr. Parinas was appointed as the new chief of hospital. In the same year, infrastructures were realized through the Health Facility Enhancement Program, which includes re-roofing and repair of dilapidated ceiling, ground floor elevation including tiling, construction of concrete perimeter fence and drainage system, and the construction of a 3-story surgical and OB ward building. Year 2013 to 2015, more projects of HFEP were given to the hospital for the construction of the following: parking area and rehabilitation of old concrete perimeter fence, construction of covered pathway and concrete pavement, construction of warehouse, motor pool, laundry building, expansion and improvement of dormitory building, and improvement and rehabilitation of water supply system, all of which were completed. A year after, another project was allotted for the hospital's waste autoclave, OB-GYN and surgical building, repair rehabilitation of cadaver holding area, construction of satellite pharmacy, construction of multi-purpose mini-gym, construction of dialysis unit building, construction of waste disposal facility, construction of halfway house high-risk OB patients, repainting of main hospital building, and construction of patients' watcher's kitchen. In the same year, a renovation of the old supply building was done to accommodate the procurement office. In 2015, the Department of Health, through the issuance of Administrative Order Number 2015-0041 dated September 15, 2015, sealed DJRMH legal mandate as a tertiary hospital under the full administrative and technical supervision of the DOH. This year, additional HFE projects for the construction of 2-story new laboratory and blood bank building, 2-story administration building, isolation building, and expansion and rehabilitation of X-ray room to accommodate the CT scan. An amount of 35 million was also released this year for the purchase of a digital X-ray and CT scan machine. With the support of the HFEP and additional manpower complement, slowly fulfilling the institution's mandate to operate a 200-bed capacity hospital to serve the constituents in the community and to its nearby municipalities and provinces. Being the only DOH retained hospital of Zamboanga del Norte, DJRMH caters to patients including Zamboanga del Sur, Zamboanga Sibugay, and Misamis Occidental, and serves as the core referral hospitals of Zamboanga del Norte and the Shrine Interlocal Zone serving the municipalities of Rizal, Sibutan, La Libertad, Pinian, Mutia, and Dapitan City. Moreover, in 2013 and 2014, DJRMH was rated as Better Hospital among the Level 1 hospitals in performance-based bonus. In 2015, ranked as number 1 and best among the Level 1 hospitals on PBB. 2016, DJRMH received the Red Orchid Award for having garnered a total of 102.17% based on the DOH criteria for implementing a 100% tobacco-free environment and became an ISO certified hospital. This year of 2016, the DJRMH celebrates its centennial years of existence, 100 years of doing its mission to give the public the quality health services the people deserved. Looking back, the hospital have reached that far, with the entire working force of Dr. Jose Rizal Memorial Hospital, the willingness of every individual to do their part, and with the continued support of the Department of Health, shall continue its mission to guarantee equitable, sustainable, and quality health for all Filipinos, especially the poor, and to lead a quest for excellence in health, making it a global leader in health services. A place of refuge, a facility that not only cures but heals the ailments of the body and soul.